Well, hello everyone. I'm Joanne Morgano. I'm a wealth manager and financial planner at Laurel Oak Wealth Management in Marlton, New Jersey. I'm also the chair of the Women's Network. So I'm so excited to be with you today, but as fate of the business world will have it, I can't stay for the entire meeting. So Zoe will moderate and close out the meeting for me, which I'm very grateful. And she's also recording. So that's really a perk for me because this is so important, this meeting. Over the last year, it's been a pleasure getting to know many of you, especially those that are on this call. Our goal with this Women's Network is to provide unique education and topics that are germane to women because we do have our own unique needs and we all know how very special we are. So, I think that that's a special place for us where we are right now. And of course, the other goal is to bring more women into this wonderful, caring, and helpful group. In October, we kicked off with a Travel the World series with Karen Loftus. She's a travel advisor. And in December, we had a great virtual networking session with Kimberly Rice. She's also a Beacon member. And that session was about how to supercharge your networking in 2025. Barbara, some things to come that we're trying to put into place. Next month is International Women's Day, which is on a Saturday, March 8th, and Barbara Taylor and I are going to have a call at 2:30 to kind of throw some ideas forward. Some other things that events that you said that you were interested in based on the survey that I sent out in the summer was living a luxurious and financially stable life, entrepreneur forward, some definite do's and some definite don'ts, embracing the power of public speaking and getting more comfortable with it. Public speaking is a huge fear for many, many people. Another topic that you are interested in is retirement. Is it going to be boring or is it going to be amazing? Another topic is lean in, speak up, and just do it. And of course, for me, anything that you want to see or think about is just please present it. Please talk to me. And we're all here to help and to bring more speakers and more women to the forefront. And today's meeting was born through member Julie Smith. We were chatting at the end of the Travel the World meeting in October, and Julie had mentioned her great experience with our guest speaker today, who is Lauren Hauser. And Julie mentioned the value of working with an integrative specialist. So I think all of us on this meeting today are looking for more answers, more solutions to how to understand our bodies better. Maybe your issue is to sleep better or to lose weight or get those hormones aligned better. I know this is the meeting for me, so I'm so glad we're recording it. But I'd like to introduce our speaker now and just give you a little bit more about Lauren. She's a board certified family nurse practitioner with over 15 years of clinical experience at her Central Bucks Integrative Medicine. It's her own practice. She combines the best of the conventional and holistic medicine to deliver cutting edge care to her patients. Her mission is to educate and provide patients with the tools and support to achieve true wellness. Lauren can diagnose, she can order, interpret testing, and prescribe medications. She also completed a 2-year integrative medicine fellowship at the prestigious Center for Integrative Medicine at the University of Arizona Medical School under the direction of Dr. Andrew Weil. Lauren was a scholarship recipient and one of only a handful of nurse practitioners in a highly respected fellowship program. She's an active member of the Institute of Functional Medicine and has participated in advanced functional medicine training. She also has been highly trained by Dr. Georgia Tetlow, a Philadelphia Integrative Medicine specialist, where she has successfully specialized in infertility, digestive conditions, especially SIBO, and thyroid support. So I think that you're going to find through our presentation today with Lauren that she's warm, compassionate, and engaged. And I'm happy to kick it off now with you, Lauren. So thank you for joining us.
Thank you so much. And thank you so much for having me. It's a delight to be here. And thank you for such a warm introduction. Um, So this is a passion of mine, speaking to women in particular. Um, this is an echoing of what Joanne just said, a little bit about me. I am a nurse practitioner. I'm conventionally trained. I went to Jefferson in Philadelphia, so I can prescribe and diagnose and see patients independently. I've been in practice for 15 years as an NP. Prior to that, I was a neonatal intensive care nurse. So I took care of little tiny babies, and then I always say I took care of the big babies in the outpatient setting. Um, I completed an integrative fellowship. I did IFM training. And then just in the last 6 months, I became certified as a menopause specialist through the North American um, Endocrine Society, which I'm super excited about and has been very helpful for my patient population. I am also a business owner. My practice is in New Hope, Pennsylvania. It's called Central Bucks Integrative Medicine. I've been open now for almost 7 years, believe it or not. And it's continued to grow, which has been fabulous. And I'm most importantly a mama of 3 daughters, 12, 8, and 5. So that keeps me pretty busy. I'm a wife. I'm an avid reader. And I like to cook. And I'm a big Eagles fan. So I actually did this before the Super Bowl, but go Birds. So I wanted to start to talk a little bit about integrative medicine because there's a lot of words out there surrounding this type of care, whether you hear holistic or functional and integrative, and it's confusing. Like, what does that mean? So for me, integrative medicine is first and foremost patient-centered. I believe, and research supports, there is a huge value in the patient-provider relationship. It is part of the healing process. It is essential. It is also root cause approach. I am looking for the why. I want to be proactive. I want to be preventative. I don't want to use Band-Aids and I don't want to treat symptoms. I want to figure out why you're feeling that way and what's going on at the deepest level that we can. And then I want to use the best available tools to treat that. So sometimes that is conventional medicine. Sometimes you need thyroid hormone, and sometimes you need hormones, and sometimes you need an antibiotic. But there's also this whole host of other options and therapies that are research-based, that are evidence-based, that are safe, that can also help and guide healing. So we want to use all the tools available. So for me, an integrative approach is patient-centered, root cause approach, proactive, preventative, optimal health, not just, normal or in range. We want optimal, and we want to use all the tools available to get you feeling your best. So there's a lot of topics in integrative medicine, as you can imagine, because our body is so interconnected. But I wanted to narrow it down and really focus on women, particularly women in, from the 40 to 100 range, that second part of our life. Because I think, this demographic, we fit into that, and we're also been a group of women that has been ignored for a long time. And I'm very happy that it feels like menopause is having a moment right now, or perimenopause is having a moment. They must have the same PR firm as kale and cauliflower has over the last 10 years. But it's due. And hopefully research and research dollars also follow that, so we can learn more and have more available to help. So what is menopause? It is literally a day. One day in our life that's a year from our last menstrual cycle. The average age is 52, but normal can be anywhere from 45 to 55. Perimenopause is the time 7 to 10 years prior to menopause, and that's a time of it's like puberty in reverse. It's a rapid drop and rise of hormones. And I feel often my patients come in and they just feel different. And it usually starts somewhere in that 40 to 45 range where they can't even put their finger on it. Just things are changing. My body composition is changing. My mood is changing. My patience is changing. My cycles are a little off. That's usually kind of a sign that I always tell to lean in and listen to your body. Your body's giving you information, and we need to dig a little deeper. So what happens essentially during menopause that drives so many symptom changes is that drop in estrogen. Estrogen affects nearly every part of your body. So some of the systemic changes I have kind of listed here, but actually the first and foremost one I want to talk about is brain. So our brain makes a ton of estrogen receptors, and it is important for mental clarity, focus, cognition, recall, certainly for mood, and also plays a role in our vasomotor symptoms, things hot flashes, night sweats. So when we get to that perimenopause, menopause, postmenopause place, estrogen is no longer available to our brain, and our brain kind of freaks out. And I think most of us have probably experienced that, where you really feel like you're almost have dementia symptoms for a time period where recall is an issue. Things that you could multitask before, you can no longer multitask. You can become forgetful. Mood can shift. There's a pretty high rate of increased diagnosis of anxiety, depression, and ADD during perimenopause and menopause. That's linked to this change in estrogen in our brain and what happens. And then, of course, the classic vasomotor symptoms, hot flashes, night sweats, they start at the base of your brain, sending signals to your body that are very can affect your sleep, and can also be very distressing. So your brain is affected. Musculoskeletal system is affected. Estrogen is actually an anti-inflammatory. So once that is removed, you can have increased pain. It also acts as a lubricant in your joints. So there's a higher incidence of things like frozen shoulder, hip pain, knee pain in peri and postmenopausal women, because those joints, those ligaments, those tendons are not provided with the same lubrication, and there's more inflammation. Your skin. So when we go through perimenopause and menopause, we lose 30% of the collagen in our skin. It does slow down after menopause, but those 10 to 12 years, we have rapid loss. And that can cause, obviously, some sagging of the skin. It can cause actually some loss of the bone structure underneath. Elasticity for sure, can all be affected. Our genital urinal system. So this is a big one for me. The tissue in our vaginal tract does not just impact sexual intercourse and intimacy. It plays a huge role in our urinary health as well. When estrogen in this area drops, we get dryness, but it also changes the microbiome of the vaginal canal. It's pretty much one species, and when estrogen drops, we have less glycogen, and it causes an overgrowth or a change in the microbiome, which can increase your risk of things like vaginal yeast infections. You can get some discharge, bacterial vaginosis, and UTIs. The lack of estrogen also changes the musculoskeletal nature of your genital urinal tract. So it can affect the pelvic floor muscle, which holds everything up, can become off, and that can increase urinary incontinence or frequency. It can also contribute to painful intercourse. The lack of estrogen causes the vaginal canal to narrow, and then the urethra opening drops closer to the vaginal opening, which also increases risk of urinary tract infection. So as you can see, it's not just, hey, there's some dryness. It affects the genital urinal system overall. Metabolically, I think this is probably the one women complain to me about the most, is there is a shift in visceral fat accumulation during perimenopause and menopause. There is some weight gain around the middle, which typically it's called visceral fat because it goes around the organs. There also is a metabolic shift in cholesterol and insulin resistance. One thing I often see in lab work and women coming in with is, I'm doing the same thing. My food is the same, my exercise is the same, and my cholesterol jumped 20 points. Like, what is going on? That can be hormonally derived as well. And then, we touch base around the visceral fat piece of the puzzle. So pretty much every organ system is impacted by changes that happen hormonally for us. So what do? We know this is happening, right? And if we're all lucky enough to live long enough, we will go through menopause. Like, how do we address this comprehensively and improve quality of life and help prevent future issues? So the first thing is always that patient-provider relationship focus is you need a really good history. I want a family history. I want to know when your mom went through menopause. I want to know what her symptoms were like. I want to know a history of osteoporosis, dementia, cardiovascular disease. I want to know what your menstrual history is like. What was it easy to get pregnant? What were your pregnancies like? What are your symptoms? Really evaluating all of those areas so I know how you're feeling day to day. And then I want to validate them. Like they're real. They're not in your head. You're feeling them. They're important. Let's figure out how to support you. The support piece, I do like to do some comprehensive lab work. Integrative care is individual care. So what might be going on with one person might be completely different for another woman. So I do want to get comprehensive blood work. And this, even though I don't take insurance personally, I do usually run labs through insurance. So they're LabCorp request based. So they typically get covered. And we can get a wealth of information through that. And I'll share what I order on the next slide. I also do some functional medicine testing as well, if that's indicated. I like to look at the microbiome in your gut. That can be important if you're having GI issues or you have autoimmune disease. I sometimes will look at a breath test, which evaluates the small intestine. There's other possibilities for assessing, but I always do the blood work. We need to get a baseline there. And then it's important for all women to have a DEXA scan. So this is a bone density test. The one thing I didn't mention of what effects estrogen has on your bone. So there's a rapid loss of bone quantity during perimenopause, actually. We lose 2% of our bone density every year of perimenopause. It does slow postmenopausally to about 0.5%, but there is no doubt there's bone loss. And as we age, the health of our bones is paramount, not only for motility and wanting to get around and get on the floor with your grandkids, but also for mortality and morbidity. We know if you have a hip fracture after a certain age, the increased risk of dying are high, like 30%. So keeping healthy bone-wise is essential. So I like to get a DEXA scan on my patients at the start of perimenopause or as soon as possible, so that we have a baseline before the loss, or we can do what we can to prevent the loss, or it might be an indication that we need to start something sooner. After that, depending on the results, you want to get a DEXA scan every 1 to 2 years to monitor bone health. And this is insurance covered. DEXA scans are insurance covered. I also recommend a vaginal exam and a mammogram, obviously, as well. And so here's a list of blood work. So I don't do protocols in my practice, so every patient is going to get a different set of labs, but in general, this is what I look at. So I want to assess where you are hormonally overall. So I'm going to look at estradiol, I'm going to look at progesterone, I'm going to look at testosterone. Testosterone can also drop in menopause as well, and that can affect the health of your genital urinary system, but also your sex drive, building muscle, things like that.
And Lauren, just to
yeah.
check, you did reference the listing. I'm not seeing any PowerPoint up. So were you launching that
You're not
later?
seeing my PowerPoint?
No, were you launching that later?
There is a PowerPoint. Can everyone else see it? I can see it.
Yeah, I can see it.
No, I can see it.
I can see
Okay.
it.
I don't know why. Okay, I don't know why.
I can send it to you, Julie, too.
I can just see. Yeah, I think I have it, but yeah, I just see you. So okay.
Okay. Yeah, there's a PowerPoint. So I look at all the hormones: estradiol, progesterone, testosterone, sex hormone binding globulin, FSH, and LH. So that was kind of completely looking at the sex hormone piece of the puzzle. I also look at other hormones. I want to look at a full thyroid panel, just because symptoms can overlap and that can activate during that perimenopause, menopause transition. So TSH, free T3, free T4, reverse T3, and thyroid antibodies. Hashimoto's has very high prevalence in women. That is an autoimmune thyroiditis that causes low thyroid function, and you can have antibodies 10 to 15 years before it affects your TSH. So that's something that I regularly assess. I also want to look at adrenal hormones. So that's cortisol, DHEAS. As working business women, we have a lot on our plates. We're juggling a lot. We need to make sure that from an adrenal perspective that we're managing that stress appropriately. And cortisol and DHEA are the main hormones that are secreted from that adrenal stress response gland. And once we go through menopause, all our remaining estrogen and testosterone is secreted through our adrenal glands because our ovaries are no longer making it. So that's why it's really important to make sure that we're managing stress well, all the time, but particularly during the perimenopause, menopause transition. And then the last hormone piece I look at is blood sugar regulation. So we want to look at a fasting blood glucose, we want to look at an insulin, and we want to look at an A1C. So we look at all the hormones. We also want to look at bone markers if there is some osteopenia or osteoporosis. So things like a CTX, a P1N1, a PTH, a calcium, a vitamin D, those all give us insight on what's going on bone health wise. And then I want to look at nutrient levels. It is very easy to get low in certain nutrients. And nutrients are cofactors in almost every enzyme reaction in our body. So they're kind of like the fuel. And if we don't have them, we tend to run into some problems. So things like ferritin, which is iron storage, homocysteine, which is B12 and folate, iron, magnesium, zinc, selenium, omega-3s, B12, folate. I get a really comprehensive look at nutrient status to make sure we're getting what we need. And then I also want to look at cardiovascular disease risk factors. So I look at a full cholesterol panel, plus ApoB, plus Lp(a), and also inflammation markers, because we know cardiovascular disease is an inflammatory process. And then additional labs depending on a patient history and symptoms as well. But that's kind of like, let's look at all the hormones, let's look at all the nutrients, let's look at inflammation, let's look at cardiovascular disease health. So we know exactly where you are, and we want to look for optimal ranges, not just, in range, if you will. Any questions so far? I forgot to say at the beginning, I'm happy to answer questions as we go, or I am happy to take questions at the end as well. Okay.
Well, wait a minute.
Sure.
Oh.
Hey, Mark.
Oh, this sounds dreadful.
You're like, I don't want to do it.
Oh, I mean, everything that you've talked about, it's like, oh my God. And part of me was like, hey, I can't wait till I am post-menstrual because I don't have to deal with it anymore on the monthly basis. But everything you've now said is like, oh my God.
Yeah,
Is there life after this? Please let me.
There are. So don't worry. The next slide is about all the things we can do.
Okay, cool.
We're gonna get there. So yeah, we can't escape menopause. It's like I said, if we live long enough, if we're lucky enough to live long enough, we will all go through it as women. But there are tools that we need to be thinking about and we need to be implementing to not only improve our daily quality of life, but also to reduce and prevent long-term sequelae. So let's go through those things now. And they're both lifestyle, medication, supplement, my body pieces that all can all be a helpful tool. And when I'm meeting with patients, these are all very tailored and individual to both them and their laboratory results and symptoms. But just as a general overview, let's start with nutrition. I think we've all kind of been around long enough to be there's low fat, and then it was low carb, and then it was high protein. We've seen so many different trends with diets. We know there's no perfect diet or nutrition plan. It's really the one that works best for you and meets your needs, and also the one you can stick to. For me, the priorities for women in midlife is protein. So we want to maintain our muscle mass and potentially improve our muscle mass because it is a metabolic organ. So it will help with our blood sugar regulation, our insulin resistance. It is also essential for our bones to have good muscle connectivity and health because it keeps them healthy. And then for our quality of life, right? We want to be able to, put our suitcase in the overhead bin, and we want to be able to pick up our grandkids. We want to be able to live alone as long as possible. So maintaining our muscle health is essential for those things. And dietarily, that starts with protein. Go ahead, Leslie.
I have a question. What are your thoughts on intermittent fasting?
Great question. So intermittent fasting can mean a couple different things. Typically, it refers to time-restricted eating, which is setting a window in which you don't eat outside of. The goal of it really is to limit caloric intake. That's the thing. I always say with diets, there's 3 ways to do that. Modify when you're eating, what you're eating, and how much you're eating. The easiest modifiable factor is when, for sure. So if we're trying to lose weight, I do typically start with that piece because it's the easiest for people to follow. There are other benefits of it, mostly that it gives your gut a chance to rest. Because if you're constantly eating, your stomach is never empty and your liver never gets to detoxify and all those things. It can also help with glucose insulin interaction as well. So it can improve insulin sensitivity. I typically for women do not recommend a very extreme fast because we are super complex and awesome, and our hormones are more complex than men. So I usually don't push past like a 14-hour fast window because then you tend to run into issues with cortisol and other things. I would say all people could benefit from a 12-hour fast, meaning let's say they finish dinner by 7, they don't eat again until 7 the next day. Like that is safe all around unless you have, something extreme. Pushing it to 14 hours is totally fine. I will sometimes do a 5-day fasting mimicking protocol with patients when we're need a kickstart for weight loss or there's some inflammatory condition or autoimmune condition at play. I prefer a plan called Prolong. It's called PROLON. It has about 25 clinical trials that show it reduces inflammation and can jumpstart weight loss. And it's a kit you buy and you follow it for 5 days. And it's like a low caloric diet, but it mimics what your body would do if you did a 5-day fast.
Thank you.
Yeah, absolutely. So in terms of protein recommendations, the RGA versus if you're a bodybuilder, they vary tremendously. I would say overall, I like women to get close to 100 grams of protein a day. You can go anywhere from 0.8 to, 1 to 2 grams for ideal body weight. So the recommendations vary, but I find that most people, if we can get 100 grams a day or 90 close to it, that's great. It's really important to have a high protein meal for breakfast, which is a challenge. So you're really looking for about 20 to 30, even 40 grams of protein at breakfast. If we get 20 to 30, I'd be delighted. This starts protein muscle synthesis. This also sets you up for not snacking all day because it's increases fullness. It actually, after 20 grams of protein, you have an activation of GLP-1 for about 2 to 3 hours, which helps with satiety. And then having high protein at breakfast also helps with glucose regulation throughout the day. So you want, 20 to 40 grams at breakfast, you got 20 or so at lunch, and then you got the same 30 at bedtime. You'd be getting pretty close to the 100. You also want fiber. So fiber is food for our gut bacteria. So when we eat fiber, the bugs that live along our gut lining take the fiber, they eat it, and then they shoot out short chain fatty acids, which is the food for our cells of our gut lining. So it's a very symbiotic relationship, but we need to take care of them because they take care of us, and that's where our immune system lives. So we want to try and get somewhere between 20 to 30 grams of fiber a day. 20, I'd be happy with 20. Veggies are a great source, beans and legumes, some grains can be. This is an easy thing to supplement as well. It typically comes in a powder, but getting fiber is helpful. It's cardiovascularly helpful, good for your digestive tract, good for blood sugar regulation. And then sugar. I think we all know there's not really any benefits of sugar besides the delight of it. But keeping sugar as low as possible it's not only anti-inflammatory, but it's going to go a long way in helping to keep our weight down and such. So those are the principles that I focus on: high protein, high fiber, low sugar as a basis. And then as many whole foods as possible. I would say stick to the outside of the grocery store. Things that don't come in boxes are always better bets. Any questions on the dietary recommendations, just in general? Obviously, they're going to vary individually per patient. Okay. The second one, as the daughter of a wine salesman, it pains me to say, but alcohol in women as we get older, it's a tough one. Unfortunately, we do not metabolize it well during perimenopause and as we get older. And the biggie piece for me is it disrupts your sleep. Can help you fall asleep for sure. But what happens is it affects blood sugar regulation and we tend to wake up, usually around 1 or 2 a.m., sometimes with palpitations, sometimes with sweating, but it disrupts REM sleep. So reducing alcohol as much as possible is recommended, unfortunately. If you're gonna have alcohol, which I totally understand, I do have 3 kids, have it earlier. So have it either before dinner or with dinner, and then have it with a meal. That helps. And then sleep. Sleep is essential, and it can get more difficult as we go through perimenopause and menopause. Our sleep hygiene is a big piece of this. So things that are helpful: trying to go to bed around the same time and getting up on the same time each day. Avoiding screens at least 30 minutes before bedtime. The screen has a blue light that tells your brain it's morning, wake up, and then we're trying to go to sleep. Sleeping in a cool room, dark room, all helps. Avoiding alcohol helps. If you're a sensitive sleeper, exercising earlier in the day helps. Obviously, avoiding caffeine after lunchtime helps. There are some supplements I find super helpful for sleep that are generally safe for most patients. Magnesium glycinate probably being my favorite. A lot of us are low in magnesium, about 40% of the population. And magnesium is a natural relaxer. It helps promote sleep. It helps us poop. It helps prevent headaches. It helps with muscle tension and aches. So it's a good one. That can be very helpful for sleep. Things like phosphatidylserine, L-theanine, passion flower, hops, lemon balm, even melatonin periodically can be helpful to facilitate a good night's sleep. The fourth, which I probably should put up here with diet because it's probably in the top priority, is how we move our body. This is a non-negotiable. If you want, I always like to say you're training for the last 2 decades of your life. If you want to live independently, if you want to be thriving, if you want to do your own grocery shopping and you want to do all those things, you have to start moving your body in a way now that's going to facilitate that. And yes, that includes some cardiovascular activity, whether it's walking or the treadmill or swimming or biking or whatever you enjoy doing, but it has to include some strength training. We have to protect our bones. And there's been some really, really cool studies showing how powerful strength training is for our bone health. My favorite one is called the Lift More study, and it was done in Australia or New Zealand. I'm actually not quite sure. But it took postmenopausal women with osteoporosis, and it put them in a twice-a-week PT supervised strength training program. It was 45 minutes, and it was basic moves. It was like bench press, squats, pull-ups, I think it was only 5 or 6 different exercises. And they increased weight over time. And the benefits that it had on bone health surpassed any medication that's available. So there's things we can do from a movement perspective that can be really restorative. So strength training is great. And it doesn't have to be a lot, right? Twice a week, 30 to 45 minutes. If you have a diagnosis of osteoporosis or osteopenia, you can even get a prescription from your primary or whoever is treating you for physical therapy for that, to learn some exercises if you don't feel comfortable or don't know what to do. There's also great resources online, and there's trainers that are great at this too. And start at low weight, start at body weight, start with 5 pounds, and then slowly progress over time. But it doesn't have to be a lot. It just has to be consistent. The other thing that's beneficial is plyometrics, and that's a fancy word for some sort of dynamic or jumping type of movement. Again, be careful with injuries, histories there, but this puts stress on the bones. And when you put stress on the bones, it causes remodeling and building of strength. So this can be box jumps, this can be jump rope, this could be certain yoga poses that can, and again, it doesn't have to be a lot, 5 to 10 minutes twice a week, can help build bone. It also, plyometrics also helps with balance. And again, we don't want to fall and we don't want to break anything. So we want to have strong bones and we want to have good balance. So we want to work on both of those things. The other piece is repleting nutrients. So this is where we refer to the testing and say, okay, what are you low in? Do you need B vitamins? Do you need magnesium? Do you need iron? What are those nutrients that we can replete so that you have all the things you need to make hormones and get rid of hormones and build bone and make neurotransmitters so you can sleep at night. So we really want to replete the nutrients. I usually do this a combination of through dietary changes. Like if you're low in zinc, we need to eat more animal protein, or we need to eat some oysters, or we need pepitas. But also if you're at a certain level, I might say, okay, we need to do those things, but we also need to take a supplement for a little bit of time to build back up the reserves. So you want to combine it with when do you need supplementation, when do you need diet, or when do you need both? Oh, went the wrong way here. Another key component is how do we balance hormones and when do we need to replace them? So I talked in the beginning about how integrative care is root cause approach, right? We know the cause of the changes, right? Your estrogen is shifting. There are certain things we can do to support that, listed above, but sometimes we need to replace those hormones. Unfortunately, for the last 20 to 30 years, hormones have gotten a really bad rep. And they've scared a lot of patients and a lot of providers into offering them as an option. I don't think everyone should take hormones or everyone is a candidate for them. But I always echo what Dr. Mary Claire Haver, who's a menopause provider, says, is that everyone deserves the conversation and to make an informed decision for themselves. So what we now know is the study that kind of scared everybody off of hormone replacement was, not only poorly done, but misinterpreted. And the risk of hormone replacement therapy, particularly with what we have available now, which is transdermal low dose estradiol that's bioidentical and also bioidentical progesterone, has a very little, if any, increased risk in breast cancer. And believe it or not, it was the progesterone arm, not the estradiol arm, that did have the very insignificant increased risk. There's also been data that says it's a critical window, meaning the benefit of replacement, not to say you're not a candidate if you're out of this window, but really falls within the first, 10 years of your last cycle. That we know that can be protective for your bone health, that it can be protective for cardiovascular disease development, and it can be protective for dementia. We know that in that 10-year window, if it started, it has preventative effects. Beyond that, we don't know, and there's some support to say that it could have the opposite effect. Potentially. If there's already cardiovascular disease developed and then you add a hormone on top of that, that could be problematic. So it's a conversation, I think, I like to have with all my patients around age 40, regardless of whether they're symptomatic or not, is to start thinking about it, start researching it, get your family history, so that you can make an informed decision. And I am a big believer, if it's something that you're interested in and you're a candidate, starting early, starting in perimenopause, particularly because we know a lot of the collagen loss, a lot of the bone loss, a lot of the cardiovascular diseases starts then. The other thing that so that's systemic hormones, right? So that's a patch, that's a pill, that's affecting, you're getting it everywhere in your body. You can also replace hormones topically. So, for example, I'm a big believer that almost all postmenopausal women should be on vaginal estrogen if you're a candidate. That tissue is so important, not only for intimacy and relationships, but also for our urinary health, our pelvic floor. And that is not absorbed systemically. It is insurance covered. It's not going to increase your risk of breast cancer. And it keeps the tissue really healthy, and it can be a game changer. So that's something that I encourage women to think about, look into, talk to the providers about, because that's a low risk and a big reward. Is also very helpful at preventing UTIs. So if you're someone that struggles with that, that should be first line. And that's not just my opinion. That's like the nephrologist and urologist's opinion as well. The other thing that's a little more on the unconventional side is you can also apply estriol, which is the weakest form of estrogen, to your face. So it can be helpful for collagen formation. It can be helpful for wrinkle prevention. It doesn't get a huge systemic absorption. So that's something too. There's clinical data that supports that. That's something that I sometimes use with patients as well. So one is like the hormone piece. There's also things we can do in perimenopause if you aren't a good candidate for hormones or you're not interested, that can help with kind of balancing this up and down period of your life. So there are supplements and herbs that help to balance estrogen and help to kind of create more of a balance. So things like DIM, black cohosh, bee propolis, these can all help with symptom management during those time periods that are non-hormonal based. And then the last piece that I talk to all my patients about is mind-body practices. We cannot separate our emotional health and our physical health. And everything we do to support our emotional health, our parasympathetic nervous system, is going to help our physical health. So I encourage patients to have some sort of daily practice. It doesn't have to be long. It can be 5 minutes. It can be a gratitude journal. It can be a breathing exercise. It can be a restorative yoga practice. It can be meditation, whatever. It can be prayer. The umbrella of mind-body practice is large. It's finding something that you enjoy and connect with and can be consistent with. So I know that was a lot of information.
Yeah.
Any questions on this piece?
Great information.
Oh, good. Oh, good. I'm glad it's helpful.
And I wish I knew you a long time ago.
I know.
And Lauren, what did you say for for support or replace hormones, the vaginal, face, and systemic? What did you say for the face? I know you talked about.
Yeah, so I have this, and this is personal, but I use Retina A, which is helpful for wrinkle prevention. That I usually tell patients to start by 30s and 40s, but you can take it your whole life. And then I add estriol, which is a weak form of estrogen, to it, and that has been shown to help with maintaining collagen in your face during perimenopause. And I get it compounded from a compounding pharmacy because they removed it. It used to be available in over-the-counter products for years. And then when everything went haywire with people's opinions on hormones, they pulled it from all the products. So now you do have to get a prescription.
Thanks.
Sure. And then I always encourage patients, if they can work with a provider, they're going to get the best experience. You need that one-on-one care to really get the most out of an integrative approach. I am located in New Hope. I am taking new patients. I do have like a 3 or 4 month waiting list, but my goal with patients is for them not to need me. So I'm always taking new patients, right? So I want to figure out what's going on. I want to give them the tools, and then hopefully they check in with me once or twice a year. I do, if you live in Pennsylvania, I can see you virtually via Zoom. Obviously, I love to see people in person, but I understand with everyone's busy schedules. This is my website, and that's my admin's information. And then there's also a lot of other fabulous providers, especially across this area. I have a lot of colleagues too that are amazing at what they do as well. These are the databases where I would suggest looking. These are the training programs that I did personally and I think are the gold standard. So the Institute of Functional Medicine, this is the fellowship link. And then if you're looking for perimenopause, menopause care, these are the list of people that have the same certification that are certified as a menopause specialist there. So I'm happy to take any questions or to dive a little deeper on any of the topics that I discussed. I think we have a little bit of time.
I'll ask a question if nobody else has one. So I'm curious, you talked about, you know, in terms of diet and increasing protein, especially in the morning. So I'm curious, you know, in order to do that, like what would you recommend that people consider, like eating at breakfast, like eating at lunch and eating at dinner, and especially breakfast, because I think that that's more of a quandary as to what to eat first thing in the morning.
Yes, it's probably the biggest question I get when I talk about protein goals. So what does 30 grams look like? So that could be, so you could do eggs. So each egg is 6 grams of protein. So if you did 2 eggs, that would be 12 grams of protein. Things like Greek yogurt and cottage cheese, I always say go plain and doctor it up yourself by adding berries. They're about 25 grams per cup. So that's a big bang for your buck too. So if you did half a cup of Greek yogurt and 2 eggs, you'd be pretty close there. You can also do things like non-traditional breakfast items. Like sometimes I'll have chicken soup if I have it in the fridge for breakfast, and that feels pretty good in the morning. You can use, you know, grass-fed things like chicken sausages that are organic or no nitrates. They have about 6 to 9 grams of protein per serving. And then protein powders or shakes can also be an option if you're a smoothie person. So whether it's whey-based, if you can tolerate dairy, or if it's pea or rice-based, if you can't, they're usually somewhere about 25 grams. And if you added some almond milk or you added some nut butter, you would get to the 30 pretty quick. So those are the breakfast ideas. And for lunch, I usually say get a mix of both animal and plant-based protein. So if you're going to have a salad, have some chickpeas on there, have some nuts and seeds, have a small piece of grilled chicken. Those are all, you're going to get to 30 grams pretty quick there. Any sort of animal protein about a serving size, which is like 4 ounces, about your palm, is about 30 grams. So whether it's grass-fed beef, it's chicken, it's pork, it's seafood, it's shrimp, that's about a 30-gram serving. So dinner is easy. Everyone gets enough protein at dinner, which is great. It's getting it early in the day that I find to be the biggest challenge personally and with my patients. But that's a great question. I get that often. And there's some really good resources out there too. If you like just even looked up like 30-gram protein meals, you're going to see a lot more out there. Dr. Gabrielle Lyon, who she wrote a book called Forever Strong. She's an MD that really promotes skeletal health. She even sends out a newsletter each week, which is helpful, that has a 30-gram recipe in it. So I find like that's a good tool too. And her website has some free recipes and downloads as well, which can be helpful.
Lauren, I have a question.
Hi, Zoe.
Oh, Julie, did you have another question? You can go ahead if you.
Yeah, I just wanted to just point out that, you know, for, you know, the lab work that Lauren mentioned that she and other integrative health providers do, that, you know, when I had it done, it was covered by my insurance for the lab work. So that was helpful. And then the other aspect is that, you know, in terms of getting the lab work done, you know, it was helpful when my mom and I both saw Lauren independently that, you know, like I need biotin. My mom doesn't need biotin. You know, she needed this. I don't need this. And so, you know, we all have different bodies. And I think it's really was an interesting process for me and for my mom to figure out like what we needed. And then the nice thing was is that, as Lauren said, like, you know, we had initial like intro with her, and then we had the blood work and then a follow-up, and then maybe like 3 months, and then maybe 6 months, and then like once a year or something like that. So it wasn't like we needed to be in constant contact with Lauren. It was just kind of like over time, because once I know that I'm pretty much always short on iron and I'm always like short on whatever else, like, you know, I may, you know, once a year or twice a year retest to see how everything's going, but pretty much my body hasn't changed that much. You know, I'm sure it will over time, but I thought that that's like kind of something helpful to throw out there to people, that like, you know, once you kind of know what your body does, obviously it'll change over time, and it's always probably good to get like an update once a year, but you're really not going to see like significant changes. I mean, Lauren, you can add to that or take away from that, but I think that like the base of what the nutrients and how my body absorbs them, like I don't absorb animal protein well, so I take a digestive enzyme for that, which is helpful because I couldn't eat red meat, and now if I take the enzymes, I can. So I can get that protein through that red meat. Just wanted to add that in case people haven't been in touch with integrative health providers like Lauren, that, you know, you can go to them, kind of get to feel like what's going on and go from there.
So Lauren, my question I had was, see you, Barbara. So I know that ideally we'd all avoid the prepackaged processed foods. But I sometimes find myself leaning on like a protein bar as an afternoon snack or something. And I've noticed a trend lately with, they all say low sugar or no sugar, and it's sugar alcohol, or it's stevia or monk fruit. It's all these replacements for sugar. And unfortunately, I wish you could just say, well, I don't care. Like, I don't want it sweet. Just give me regular without sweeteners. Is there any one that's better or worse for you in terms of those other kinds of sweeteners, like sugar alcohol versus stevia versus whatever?
It's a good question. And I think most of them in moderation are fine. I would avoid things like Splenda and NutraSweet because they have been shown to be carcinogenic. But things like stevia and monk fruit, I have less concerns about. I do notice some patients do have some GI upset with them, so I'm mindful of that. You're right. It's really hard to find bars that are just naturally sweetened. I like the RX bars. I don't know if you've ever had those before. They're sweetened with dates, which is kind of nice. There's not added sugar. And they have, you know, I think they have 12 or 15 grams of protein. And they're pretty widely available. So that's a kind of a good in between if you're looking for something.
Great. Thank you.
Mm-hmm.
I just discovered a friend shared an app for your phone that's called Yuka, Y-U-K-A, and you can hover over the bar graph on any food item
Mm-hmm.
in the store, and it gives you some information about what's
Cool.
good about it, what's bad about it.
Mm-hmm.
So things that there are these things I was getting from Trader Joe's that were egg whites and some other things, and I was thinking they were healthy. But when I started looking at them, I realized, no, there's stuff in here that, yes, there is healthy stuff, but, you know, they caution about certain things. So that's been a helpful guide.
Mm-hmm.
And it's a nonprofit nutrition research entity. So I think it's reasonably trustworthy. So
Yeah, that's a good source. I also like the Environmental Working Group has an app that's free too called Healthy Living.
yes.
That allows you to scan products too, which can be helpful for like makeup and shampoo and cleaners. They have food too. But yeah, it's nice that there's some resources out there that try and make it as a little bit easier to navigate. I also like to remind patients too to major in the major and minor in the minor. Like it's very easy to get caught up in like, what kind of sugar do I have in my bar? But you're also not eating a whole meal, or you're not exercising, or you're not sleeping. So I'm always like, focus on the core stuff, like focus on the core stuff. And then we'll get to the minute stuff when we've got the core stuff down. So that's a reminder too. I have to give myself and to other patients because it's easy to get caught up in the, oh, but it has this, but what about that? But it's like, I didn't exercise today. Well, let's do that first, and then we'll worry about what's in the bar. Type of thing. I think we're done on time. Obviously, my admin's email is here. If anyone has any follow-up questions that I can hopefully answer for you. It's really nice talking to you all. I love speaking with women, particularly women in business. And thank you for having me.
Thanks, Lauren. Awesome.
Thank you so much, Lauren.
Beacon is a national community of senior-level business leaders committed to sharing, helping, and learning. To find out more, go to beaconforlife.org.